Righto, here we go. Another 2 weeks have gone by. So here's the week 11 and 12 update. Let's jump into the knee comparison. Definitely a productive couple of weeks in terms of starting to pack on a little bit of mass. You can see the VMO there, which is one of the muscles that gets smoked with this injury, coming back. Flexibility in the kneecap, able to move it laterally more nicely now, which is great. The ROMs is really good. The only time I get any kind of restriction is sitting in that deep squat and it's a bit tight around the fat pads. That's where I've got a bit of swelling. So you can see the width of the kneecap, like it's still holding quite a bit of swelling. In the next kind of 2 to 3 week block, I'm definitely going to work to pull some swelling out of that. Ease up on the leg extensions, for example, which compress the fat pads, and swap to Spanish squat. Maybe take 3 to 4 days off the quad loading to see if I can pull a bit of swelling out of there as well. Going into the pain scores, past 2 to 3 weeks have been pretty similar. There's always a little bit of pain, which is increasing in the evening because the load is quite high at the moment. I expect it to stay this way. It's definitely manageable. We're going to the measurements here. Body weight sitting around 90, 91 at the moment. Looking at the thigh measurements, if we focus on the bars, you can see the lower third of the quad is definitely lagging, which is the light blue line, at around like 92, 93% of the good quad size. And the upper thigh is around like 94, 95%. The left quad, my injured leg, was actually my dominant leg. For this to be fully repaired, it probably needs to be larger than the right hand side. So I'm gonna aim for there. Jumping into some of the ROM stuff now, really good progress here. The peptides have been really helpful in pulling out the swelling and increasing flexibility in the tissue. Technically, I'm at full functional range at the moment, but I was quite mobile before. I can squat really deep and sit with my ass touching my calves. So I think there's probably still 10, 15 degrees that I want to get here. And obviously with the active prone, the total ROM that you can get here is actually less than the above. Close or on par with a functional level of ROM, but I just want to get it back to that pre-injury level. So we'll keep moving there. Just a quick look at the squat ROM here. It feels good sitting here, but there's probably some more degrees that I need to get, and a little bit of compression in the fat pads. I think there's still a bit of lingering swelling, progressing well. You can see here, like my ROM is getting a little bit more aggressive. I'm doing the couch stretch at the moment. The real limiting factors have been putting weight on the knee. Hasn't been super comfortable, but it's definitely getting there. If we look at the comparison point on the uninjured leg, the ROM is very strong. I can sit in this position comfortably, so this is the benchmark I want to hit for my injured leg. Started to implement probably like 10 to 15 minutes of incline backwards walking every day. I'll generally just do this after the bike, which gives a nice low impact load on the tendon and quad area and gets it nice and warmed up. Really pleased with how this is progressing. I think it's pretty much where it was pre-injury. I think there's probably a little bit of tweaks here and there that I need to clean up, but I think that they will come naturally over the next few weeks or months. Step count around 10,000 a day. It's about as high as it's probably going to get until I can start running and really pounding some Ks. Let's jump into some of the quad strength metrics. We were initially looking at the single leg press isometric hold length and weight. I'm still doing all these isometrics every week. I'm just trying to work out what the best metrics are to track quad strength. There's a few exercises that I'm doing for my concentric focus lifts on a weekly basis. I've got the leg press up around 200 kilos. The ROM here is probably past 90, which is nice. I'm getting 12 to 15 reps, super slow eccentrics. All of these lifts are like 3-second eccentrics, really controlling and protecting the tendon and also strengthening the tendon. The slant board front squats, week 12, probably did the 45 kilos for 15 reps there. Once again, the slant board squats are really heavy on the tendon and specifically targeting tendon strength. This isn't going to be necessarily as strong as a normal front squat or Bulgarians or even the leg press because of the position, elevated heels and the knee tracking over the toes. Bulgarian, super strong, like 50 kilos on the single leg, 12 reps, super controlled. So it's all coming along nicely. Have a look at the front squat set. So it's all looking and feeling pretty good, improving week by week. Definitely a lot less pain in that bottom range of motion. I'm really excited to continue to work my ROM back over time. Hitting the Bulgarians over the last couple of weeks, not on the Smith machine, to bring a couple of the stabilizers in and see how the knee handles without the stability. Help getting super strong, feeling really good, so progressing well there. Still, the main isometric exercise I'm doing is the Bulgarian. It's allowing me to isolate the leg and not have any compensation. Once that strength comes back, I'll probably do more bilateral isometric exercises, but for now it's working really well. I can really push the weight here, like 50, 60 kilos on the single leg, 45 seconds to a minute holds. You can really get a great amount of force production through the isometric. Leg extensions, still hard, probably the last exercise that gets good through this rehab process. I'm not pushing it too hard. It puts a lot of strain on the tendon. Just being careful, but still pushing to get that good VMO engagement and get the tendon used to that movement carefully is the goal. Gone into the posterior chain, solid. I did 48 kilos on the single leg for the RDL for 12 to 14 reps, slow, controlled. The strength is really there, the stability is really there. I think the posterior chain in no time will be back to parity with what it was before the injury, so that's excellent. Kickstand RDLs have been excellent over the past month or so. I isolate that leg. Probably going to start looking at going to the bilateral RDL because there's probably not as much compensation for the posterior chain movements. It's really starting to lift in terms of its strength. Week on week, packing on the kilos here. It's feeling really good. It's feeling really strong. So excellent exercise for the earlier stages of the rehab for sure. GHR. This, along with exercise like the Nordic, were definitely a staple in my workout routine prior to the injury. I'm really stoked to be able to bring these back into my routine now as a posterior chain movement. Obviously not very strong at the moment. I can't control the eccentric as much as I would like to. That feels good on the knee, and it's just something that I'm going to continue pushing with. Leg curls, standard, excellent exercise, just increasing the explosiveness week to week, moving to bilateral here as well, which is excellent, good progress. Calves probably going to be the muscle that comes back to pre-injury levels the fastest, pretty much there already. Still hitting the tib raises. I think a lot of people neglect them, smash the calves and forget about the front part of the lower leg. So definitely still a staple in the program. Abduction work, just continually increasing the load and the reps here. Have 2 of these heavy bands at the moment and I'll just keep increasing that load. I think it's a really nice functional abductor movement. For adduction, just continuing through the progressions for the Copenhagen plank. I'm able to hold with a straight leg closer to my foot now without too much pain in the sides of the knee. Progressing really well, really good adductor exercise. Still pumping the hip flexor work here every few days, really working to get these back to where they were. It's going to be super helpful once we get into more athletic movements like running and plyometrics. The straight leg raises over a foam roller, doing stuff like the elevated leg lift with the kettlebell on the feet, really great for the hip flexor. Also playing around with some band work as well, more of a dynamic movement, and it puts a little bit of pressure on that tendon, which feels nice. Bit of proprioception and hip work here, super hard on the glute med and really hard from a balancing perspective. So really enjoying this to bring a lot of balance and strength back into the knee. Increasing the amount of mobility work I'm doing mobility work pretty much every day now that the knee is a massive limiting factor. Starting to open things up and work on things like hip external rotation like you're seeing here. These active 90/90s are really good. Apologies for the huge rip in my trackies. I only really got 1 pair, so deal with that. Also working on that strength of that 90/90 position. These were really tough a week or 2 ago and quite painful, but really starting to progress nicely. It's feeling really good and helping opening things up. Really working to just open everything up, open up the hips, open up the groin, using weights to push these down. Sitting in this position with the knee inflection was quite painful previously, but really starting to feel a lot more natural. I'm trying to sit cross-legged, for example, in the sauna for 30-45 minutes a day to really get used to that movement again. Other hip openers using weights, feel really good, super enjoyable. Do these daily or every 2 days. A lot of hamstring mobility, like elephant walks and standing hamstring stretches as well. Working on things like that frog pose to open up those hips as well, super good exercise. Another one where the limiting factor is a little bit the uncomfortableness of the knee being on the ground, but definitely something I'm trying to work to get used to. It's a quick overview of weeks 11 and 12, very similar to weeks 9 and 10 in terms of the goals, centered around strengthening the tendon, increasing the load in the tendon, and just packing on the muscle mass in that leg. Really enjoying this part of the process and starting to get into the mobility and getting my body feeling a little closer to where it was pre-injury. I think this is going to be really important when it comes to the more athletic components of this rehab in terms of getting the running gait back and the plyometrics and agility and speed, etc. Just laying the groundwork there and hoping that I can build a good foundation for when that time comes.